The World Health Organization (WHO) has officially called the disease a pandemic, a disease outbreak occurring over a wide geographic area and affecting an exceptionally high proportion of the population. The United States of America has declared the pandemic a national emergency, and states throughout the country are taking major measures to slow the spread of the disease. Following measures are being taken in the United Kingdom also, with schools closing and a recommendation from the government not to go to any bars, clubs, restaurants and theaters. Number 1. Information about coronavirus is still evolving. The name coronavirus refers to spikes seen under a microscope on the surface of the virus. Corona is the Latin word for crown. Coronaviruses cause respiratory tract illnesses that range from the common cold to such potentially deadly illnesses as SARS, also first identified in China, and Middle East Respiratory Syndrome (MERS). According to the CDC, this is the first pandemic known to be caused by the emergence of a new coronavirus. Novel influenza viruses caused 4 pandemics in the last century, which is why the response to coronavirus is being adapted from existing guidance developed in anticipation of an influenza pandemic. According to the CDC, reported illnesses have ranged from very mild with no reported symptoms in some cases to severe, including illness resulting in death. Older people and people of all ages with severe underlying health conditions seem to be at higher risk of developing serious illness. But doctors still don't have a complete clinical picture of COVID-19. Number 2. Experts are taking steps to address the coronavirus and reduce infections. The number of cases in the U.S. has continued to rise. It includes imported cases diagnosed in travelers, people who were close contacts of other known cases, and community-acquired cases, meaning there was no known source of the infection. Proper testing that is made widely available will be important in understanding how the disease is transmitted and the true infection and mortality rates. In addition to coronavirus testing being done by the CDC in the U.S., local public health labs in all 50 states and the District of Columbia are currently using the CDC's COVID-19 diagnostic tests, although the number of available tests is limited at this point. Until there can be comprehensive testing for coronavirus, it's difficult to know how many cases have not been identified. Testing is still very limited but is prioritized for those that are the sickest. Meanwhile, China currently is testing a number of therapeutics in clinical trials. In mid-March, the National Institute of Allergy and Infectious Diseases (NIAID) announced the first testing in humans of an experimental vaccine called mRNA-1273 developed by NIAID scientists and their collaborators at the biotechnology company Moderna, Inc. But it could take at least a year before such a vaccine is available. Number 3. If you feel ill, here's what you can do so far. Information shows the severity of COVID-19 infection ranges from very mild, sometimes with no reported symptoms at all, to severe to the point of requiring hospitalization. Symptoms can appear anywhere between 2 to 14 days after exposure, and may include fever, cough, difficulty breathing. You should call your medical provider for advice if you experience these symptoms, especially if you have been in close contact with a person known to have coronavirus or live in an area with ongoing spread of the disease. Seek medical attention immediately if you experience emergency warning signs, including difficulty breathing or shortness of breath, persistent pain or pressure in the chest, a persistent cough or any flu-like symptoms. This list is not inclusive, so consult your medical provider if you notice other concerning symptoms. If you have traveled to an affected country, taken a cruise in the past 14 days, or been exposed to another person with the coronavirus, health officials will give you instructions on limiting your activities and movement for up to 14 days to help keep the virus from spreading. Number 4. There are things you can do to protect yourself. As with a cold, a flu vaccine won't protect people from developing COVID-19. However, while doctors learn more about transmission, the best thing you can do at this point is take care of yourself the way you would to prevent yourself from getting the flu. You know you can get the flu when people sneeze and cough on you, or when you touch a doorknob. Washing hands, especially before eating and touching your face, and after going to the bathroom, and avoiding other people who have flu-like symptoms are the best strategies at this point. The CDC also recommends the following preventive actions. Wash hands with soap and water for at least 20 seconds. Dry them thoroughly with an air dryer or clean towel. If soap isn't available, use a hand sanitizer with at least 60% alcohol. Stay home if you're sick. Avoid touching your nose, eyes, and mouth. Use a tissue to cover a cough or sneeze, then dispose of it in the trash. Use a household wipe or spray to disinfect doorknobs, light switches, desks, keyboards, sinks, toilets, cell phones, and other objects and surfaces that are frequently touched. It may also be important to create a household plan of action. You should talk with people who need to be included in your plan, plan ways to care for those who might be at greater risk for serious complications, get to know your neighbors, and make sure you and your family have a household plan that includes ways to care for loved ones if they get sick. This includes planning a way to separate a family member who gets sick from those who are healthy, if the need arises. As for masks, there is little evidence supporting their widespread use for people who are not sick. Masks may provide a modest degree of protection against fluids, including spray from a cough or sneeze, and they provide some filtration of the air. But, since the masks do not provide a tight seal around a person's nose and mouth, much of the air inhaled and exhaled remains unfiltered. While everyone should take precautions, some people appear to be at higher risk for severe disease. A report external out of China suggests serious illness occurs in 16% of cases. Those most at risk include adults over 60 years old. The risk seems to gradually increase with age starting at age 40, according to the WHO, and those with chronic conditions such as diabetes, heart disease, and lung disease. People in these categories especially should avoid crowded places and stock up on household items, groceries, medications, and other supplies in case they need to stay home for an extended period. Number 5. Precautions remain extremely important. State and local authorities are making a variety of recommendations to slow the spread of the virus in the community. Guidelines from the White House called 15 days to slow the spread, stress avoiding social gatherings of more than 10 people, using drive-through, pickup, or delivery options instead of eating in restaurants, avoid unnecessary travel or shopping, and staying away from nursing homes and long-term care facilities since the elderly are at especially high risk for serious complications if they get the virus. Many experts are also recommending people practice voluntary social distancing, which is the practice of maintaining a greater than usual physical distance or avoiding direct contact with people in public places to minimize exposure. The CDC says the disease can spread between people who are in close contact with one another within about 6 feet. While it is especially important to maintain this distance from people who are sick, many experts are also recommending everyone practice social distancing and avoiding large crowds, whether they are sick or not. Public health authorities strongly advise everyone to get their annual flu shot if they have not done so already, as we continue to remain in the midst of a bad flu season. In addition to preventing or mitigating the severity of the flu, the vaccine will simplify the evaluation of patients with flu-like symptoms if potential cases of the coronavirus surface in the community.